We know that children aren't just small adults and that illnesses and injuries impact their bodies differently than someone who is fully grown. That's why we've invited Dr. Brent Townsend to join us today. Dr. Townsend is a dedicated pediatric radiologist at the area's only outpatient pediatric imaging center. Dr. Townsend, thank you for joining us today.
Thank you for having me.
Dr. Townsend, are all radiologists the same?
While all board-certified radiologists have taken 4 to 5 additional years of training after medical school, all of the radiologists at Wake Radiology have done additional training. For example, I did a 1-year fellowship in pediatric radiology, meaning that I focused all of my training on how to make accurate diagnoses in children. For example, if you and I were to fall off of these chairs and break our arm, that thing is just going to snap.
Right.
But with kids, they are more flexible. Their bones are more flexible.
Okay.
And there are more subtle types of incomplete fractures. People may have heard the word buccal fracture or green stick fracture that are harder to see because they're not the traditional, oh look, that bone is completely broken.
Mm-hmm.
And having done the special training in pediatric radiology, we are better equipped to make those diagnoses.
And I would assume that a dedicated pediatric imaging center probably has special equipment that sort of helps the pediatric patient through the imaging process.
Well, yes, we would do that. First of all, we make sure that we have a child-friendly environment and also a parent-friendly environment with a waiting room that is geared towards patients. They have the sick child waiting area, the healthy child waiting area, lots of colorful murals on the wall to help put children at ease.
You know, Dr. Townsend, I think another parent concern is radiation exposure.
Yeah.
Can you explain how you limit the amount of radiation that children receive?
There's been a lot of talk in the press about radiation, particularly with medical imaging, and does it cause cancer? Most people are thinking about CT scans or CAT scans.
Exactly.
Okay. Now, it hasn't been proven that CT scans cause cancer, but we do go under the principle that radiation does have risks.
Okay.
So the first thing that we want to do, particularly as pediatric radiologists, is have that discussion with the parents and with the ordering pediatrician as to the risk and benefits of any given tests.
Okay.
Secondly, with tests such as X-rays or CT scans that actually use ionizing radiation, we really try to tailor the test directly to the patient to make sure that the doses are appropriate for the size of the patient and to make sure that the areas that we're covering are only the areas that need to be covered to get the diagnosis. This limits radiation exposure. We love to use procedures that don't involve radiation, such as ultrasound and MRI. Now, ultrasound is a modality that many people are familiar with. They see it on TV all the time, in the movies, the scene where everyone gets to know the gender of the child.
Yep.
Now, ultrasound has its limitations, but in the pediatric population, given their small size, we get very detailed pictures.
Dr. Townsend, thank you so much for joining us today.
Again, thank you for having me. This has been a pleasure.
You can learn more about the topics that Dr. Townsend discussed on our website at wakerad.com.